Hello everyone, my name is Emad Beshay. I'm board certified internist in California. It's my honor and pleasure to be recording this episode about coronavirus at Evangelism TV. For my viewers, thank you so much for your time. Today we're going to talk about everything related to coronavirus. Unfortunately, COVID-19 has already infected around 16 million in the world, 4 million in the US, have taken 150,000 souls in the US and about 650,000 around the globe. We expect this virus as enormous spread to be spreading more and more in the months to come. We hope we will get a vaccine pretty soon, but at this point we need to be very cautious and vigorous and talk about what we need to know about the coronavirus. In the first slide, as we can see, the coronavirus is an RNA virus. So you can see the spikes outside. These are special proteins, spike glycoprotein. These look like forks. These attach to receptors in the lungs called angiotensin 2 blockers. Angiotensin blockers, 2 receptors. These spikes attach to them, and finally, the RNA virus is free into the DNA virus of our cells. The RNA virus has a capacity to multiply and spread into millions of viruses, and unfortunately tends to damage the lung, cause viral pneumonia, cause adult respiratory distress syndrome, respiratory failure, ventilator, cause hyperactive immunity reaction called cytokine storm, and all of these could lead to respiratory failure and ultimately death. This is another view of the spikes of the protein, glycoprotein spikes. As you can see, the RNA virus is inside. The whole idea of these proteins attached to an angiotensin receptor 2 blockers get an access to our cells and damage the cells and multiply. In the next slides, we postulate and assume the virus started in Wuhan in China. From the free market, as you can see, they're selling meat and animals, and particularly bats, in the streets, and we believe that the virus was transmitted from animals to humans. As you can see, this restaurant delivered this food, and people have gotten the virus, as it was thought, at the end of December of 2019. For that reason, coronavirus SARS-CoV-2 is different from SARS coronavirus 1, which was spread in 2002 and 2003. This courageous doctor, he's a hero. He also died from coronavirus, but he was the first one to discover this virus in Wuhan, China, at the end of December 2019. For that reason, it was called COVID-19. He died in February of 2020. So what does coronavirus do to the body? Coronavirus causes a lot of symptoms, mainly fever, shortness of breath, and cough. Fever, shortness of breath, and cough. But it can affect the rest of the body, causing malaise, fatigue, body aches, sometimes gastrointestinal issues such as diarrhea. It can cause headache, and it causes severe muscle aches. Again, in this slide, we see the most common is the upper respiratory tract. It causing dry cough, it's causing sore throat and fever, and sometimes chills, as well as respiratory distress and shortness of breath. COVID-19 is different from the common cold. It is related to these type of viruses, but the flu symptoms kind of similar to the COVID-19 symptoms. However, the COVID-19 is very transmissible disease. I've never seen in my life a disease that's transmitted so easily and so quickly, and unfortunately we don't have a valid treatment yet. So both of them can cause fever, shortness of breath, and cough, but fortunately the flu and swine flu, we have vaccine and we have treatment, but the coronavirus, we do not have yet a vaccine or a valid treatment. Again, this is a constellation of symptoms: fever, dry cough, shortness of breath. If you or your loved one has any of these, you need to consult with your doctor immediately. In this slide, it shows comparison, apple to apple, between coronavirus versus the influenza or the flu. The flu only have mortality rate 0.1%, but the coronavirus 2 to 5%. We do have antiviral medicines such as amantadine, Tamiflu for the flu, the regular flu, but we do not have a treatment valid and accurate and effective for coronavirus yet. Flu is seasonal, but the coronavirus started since last December all the way to July, and maybe it comes in waves and is continuing with us. The similarities are both started in animal, both have fever and cough, both can cause death by respiratory failure. However, I really want to warn you that the coronavirus is much worse than the regular flu. On this slide, we can see that there is an algorithm. When somebody presents with fever, shortness of breath, and cough, we should take a good history. If they are very in distress, respiratory failure, they go to the ER. We do a nasopharyngeal swab, and we send a PCR for the coronavirus. Some tests we were able to get in 3 hours. Others may take up to a day. And some others are sent out, take 3 to 5 days, even up to 9 days. Some of it is valuable and available now in CVS, but that takes a long time. In addition, there is a bunch of labs we do in the ER, including complete blood count, chemistries, CRP, D-dimer, ferritin, lactate, LDH, and different other blood tests. The chest X-ray is unique for viral pneumonia. We can see the interstitial infiltrates. We can do a CAT scan in certain patients, although we do not want to do CAT scan on every patient and spread the virus more into with the technician and use more personal protective equipment, PPE. This slide tells us that 80%, fortunately, are mild symptoms. 15% they get severe symptoms, or 14%, and some of them needs hospitalization. But unfortunately, 5% critical cases, mainly 2 or 3% of those 5 could die, unfortunately. This is a unique slide when we can look further, closer look to the chest X-ray and CAT scan. What does this COVID-19 do to the lungs? As you can see, my dear viewers, there is a lot of interstitial markings, a lot of white in the CAT scan. All of these white markings in both the chest X-ray and the CAT scan on the bottom left are abnormal. These are viral infiltrates and interstitial infiltrates from the virus. The virus attacks the lungs very heavily and can cause respiratory failure, adult respiratory distress syndrome, and even cause death. The next slide, we have more magnificent CAT scan showing a lot of damage from the virus. And indeed, the virus not only causes interstitial infiltrates like we see, but it can cause lung clots, pulmonary embolism. It can cause hypercoagulable state of the body and cause clotting, and these clots can kill the patient. This is another slide that we will see a full screen. You can see the top on the left side, there is, with these red circles, these are pulmonary embolism. These are lung clots. The clots affect the circulation of the pulmonary arteries, cause clots, and cause the blood not to go and cause death. On the right side on top, it causes clots in the brain, what we call strokes. As you see, some areas of the brain are black and lost the blood supply and become dead tissue. On the bottom slide, we see the heart, and it can cause heart attacks, can cause arrhythmias such as atrial fibrillation, it can cause heart failure, ultimately death. In summary, the coronavirus can affect almost every tissue of the body. This is again and again, you've heard it 100,000 times, social distance, wearing the masks. My dear viewers, mask could protect you up to 80 or 90%. Wash your hands frequently, 20 seconds, before and after you prepare food, before eating, after toilet use. Keep social distance and present to your doctor or to the nearest clinic if you have the above symptoms, which we talked about numerous times, such as sore throat, fever, coughing, and shortness of breath. We all stop the virus by staying at home, social distance, wearing mask, keep well hygiene, and hand wash. I cannot re-emphasize on avoiding crowded places, stay at home, save lives, avoid non-essential travel or cruise trips. This is a magnificent slide into one slide. All the green stuff, this is a very healthy fruits and vegetables that we all should be eating. Get away from any canned food or fries or McDonald's or Burger Kings or anything that can cause fried food, very heavy food, lots of sugary food. Get to the green stuff, fresh fruits, fresh vegetables, wash hands, exercise, sleep. By doing that, you boost your immunity. Get away from alcohol, get away from smoking and drugs. This is another slide of how important walking by the beach, exercise, eating healthy food. Orange juice is magnificent with a lot of natural vitamin C. On here, there is vitamin C and E and D and zinc, particularly vitamin C and zinc and vitamin D. Please buy yourself, stock it from Costco, from CVS, wherever you can get it. We advise vitamin C 500 milligram once or twice a day, at least for prophylactic. Vitamin D3, at least 1,000 international units daily, and zinc sulfate, 220 milligram a day. If somebody has coronavirus in the hospital, I tend to give them vitamin C, at least 1,000 milligram daily. And at times there was a big study in New York where we used vitamin C 500 milligram intravenous every 6 hours. For vitamin D, we advise 5,000 units, international units, vitamin D3 for people who have corona, and zinc sulfate 220 milligram. In addition, there were some studies about statins such as simvastatin, atorvastatin, and Pepcid could delay the virus spread. Hydroxychloroquine was a big talk about it, and many studies have been gone, especially after President Trump touted about it and spoke about it. Unfortunately, currently, so many studies in the hospitals where I work, we do not use hydroxychloroquine again anymore. It's not proven to be effective, especially for late cases that come to us already with respiratory distress, respiratory failure, on a CPAP machine, on BiPAP, on high flow oxygen ventilator. Simply put, we do not use hydroxychloroquine anymore. But there is still ongoing studies to try to see if this can be prophylactic or it can work in the early cases. Some studies around the globe using ivermectin, some studies in Japan and Russia using favipiravir, which is anti-influenza, antiviral medication. Recently, they've been trying to use colchicine for cases with coronavirus, but none of these proven 100% as a protective measures for coronavirus. So how do we treat coronavirus in the hospital? If it is mild cases in the clinic, you ask the patient to rest, symptomatic treatment for cough and fever, Tylenol, paracetamol, and Robitussin. We do not like too much ibuprofen or non-steroidal anti-inflammatory drugs. Keep well hydrated, sleep good, vitamins and minerals, again and again, vitamin D, vitamin C, and zinc. Frequent checking of your body temperature at home and pulse oximetry. Please do yourself a big favor, go to CVS, buy a pulse oximeter machine. It's at $29. Check frequently, and if you see you're getting short of breath, your pulse oximetry, less than 92%, less than 90%, going to 88, 87, 85, please rush to the nearest emergency room. Again, hydroxychloroquine and azithromycin we do not use them anymore. Treatment of severe cases in the hospital, which I come to treat these cases in the ICU and the floors. We check Anybody with a pulse ox that is less than 90% in respiratory distress, breathing more than 20, 24, 30, 35, 36 breath sounds per minute, that's really in respiratory distress, we start them on oxygen right away, either by nasal cannula or face mask or high flow oxygen, CPAP or BiPAP, and ultimately ventilator. We started in California using dexamethasone 6 milligram intravenous every day for 10 days, and it's proven working for severe cases of coronavirus. I'm talking about coronavirus that require hospitalization and patient severe symptoms. Dexamethasone proven in a study in the UK to decrease mortality by almost 30%, which is a great number. In the hospital, we give vitamin D, vitamin C, and zinc as well. We monitor the oxygen. We ask the patient, please listen to me carefully. We ask the patient to be on the prone position. That by itself help the lung to expand, help the treatment to go faster, help the people to leave the hospital quicker. Prone positioning plus oxygen plus dexamethasone is the way to go. Really proven in a lot of my cases, thank God, did fortunately very well. Now, we daily monitor CBC and CMP, complete blood count and chemistry panel, liver function test, and renal function test. In addition, we like to check inflammatory markers at least every other day, particularly D-dimer, CPK, LDH, lactate, ferritin, and CPK. Note coronavirus can cause rhabdomyolysis, can increase D-dimer, and that's a very, very important marker about clotting. If you see a patient, the D-dimer is going up and the ferritin is going up, that's a bad marker. You need to follow them. More importantly, do not forget the oxygen, dexamethasone, and also Lovenox. Lovenox is a life-saving. Anybody needs to get a DVT prophylaxis immediately as they go with coronavirus. Coronavirus increases the susceptibility for clotting and can cause a lung clot or a brain clot or a heart clot. For that reason, people with high D-dimer, we put them on a higher dose of Lovenox, 1 milligram per kilogram subcutaneous every 12 hours. And that is a life-saving. We did numerous autopsies on people that expired and died from coronavirus, and we found a lot of them has died from pulmonary embolism. If we find a cytokine storm, a big inflammatory war, if you will, happen in the body starts secreting all these mediators and immune response, aggressive response, almost like friendly fire. Imagine, dear viewer, you have some cockroaches in your house, and instead of getting a spray or something, you get a grenade or a gun and you start shooting around your house. That's what the body do in coronavirus. So we get something called cytokine storm, and the body starts to shut down. You get respiratory failure, you may get heart failure, you get kidney failure, you get shock and die. If we find this cytokine storm is very high and a patient on BiPAP and about to be intubated, and we check a marker in the blood called interleukin-6. But if we have very high clinical suspicion of cytokine storm and the patient is going into adult respiratory distress syndrome, we advise to give a medicine called Acterma, 200 milligram every week intravenous once or twice. That suppresses your immune response, bring down the interleukin-6. I've used it myself, and it helped people from going into ventilator. As a matter of fact, about 10 days ago, we almost lost a patient, but when we used this drug, it worked miracle. The other drug which has favorable response now, remdesivir. Dr. Anthony Fauci talked about it a lot. There is new data and valid study shows it decreased hospitalization from 15 days to 11 days, decreased mortality. Remdesivir is given 100 milligram a day intravenous in the ICU or the telemonitor floor daily for 5 days. It used to be 10 days, now we do 5 days. It has special criteria. The doctors knows which criteria. You cannot have a high liver function and renal function. It has to be within normal limits and within criteria to be given. We give this in addition to the dexamethasone, in addition to convalescent plasma and oxygen. Convalescent plasma is debatable. I've seen some people got better with it. I've seen people that did not react to it, did not get better. However, it's still a valid treatment. In the current hospital where I work, amazingly, from day one, they give the patient, they hit him hard with oxygen and remdesivir and dexamethasone and convalescent plasma, all four in 1 day or 2 days. Don't forget the Lovenox, life-saving, at least 40 milligrams subcutaneous once a day, and some physicians use it twice a day. I tend to use it 1 milligram per kilogram subcutaneous every 12 hours. If the patient 80 kilograms, then he gets 80 milligrams subcutaneous every 12 hours. There is talk about Avigan, which is a new medicine used in Russia as well as Japan. Avigan is another name, favipiravir, which is anti-influenza or antiviral drug. Hopefully it will work, especially in mild cases. And also ivermectin is being studied in Peru and other parts of the world. We hope it's going to work again for mild cases. Severe cases, oxygen, CPAP, BiPAP. Initially we didn't want to use these machines, but now we use them. High flow oxygen ventilator, plus remdesivir, plus Acterma in severe cases. And most cases get dexamethasone 6 milligram every day, intravenous or oral, for 10 days. Additionally, we check chest x-rays, we check all the inflammatory markers, which I explained before. Some physicians, a lot of hospitals, do give Rocephin plus Zithromycin, at least in the first few days, to make sure there is no superimposed infection from bacteria. How to prevent coronavirus? Healthy diet, social distance, face mask, face mask, face mask. I cannot repeat it enough. Diet, exercise, and a big one, sleep. Very important. I tell my patients, in any disease, 60% of your cure is get good sleep. Vitamins, vitamin C and D and zinc, very crucial. There is a new report from San Bernardino, Dr. Schultz. I really like, he used a new supplement called N-acetylcysteine and quercetin. Quercetin and N-acetylcysteine. You can buy them from Amazon. It decreases the inflammation and decreases the chances you get coronavirus. Control diabetes, control hypertension, control your heart. And the final thing, we're all waiting and praying and hoping about coronavirus vaccine. AstraZeneca is working. President Trump allowed the funds to go to Pfizer. And we're hopeful either Oxford in the UK or here in America we could get the vaccine. As we can see, a vaccine is hopeful by the end of this year or the end of 2021. And again, this is a slide that will show us how the whole world has changed, and the personal protective equipment in New York and Italy. And this is another vaccine of before Corona and after Corona, different parts of the world, including Paris, Italy, and different places. By this, we come to an end to this program. Do not forget that prophylaxis is better than cure. Do not forget the vitamins C and D and zinc. Do not forget a good sleep, social distance, wash your hands, wear the mask. And most important, if your loved one is hospitalized, oxygen, proning position, Lovenox to prevent clots, dexamethasone, and vitamins, and in some cases, remdesivir and Acterma. Thank you very much for your precious time. I really enjoyed being with you. Hopefully there will be more episodes. Watch tuned for the Evangelism channel for more scientific episodes. Thank you.